Happy Monday, everyone. How are you doing today? My name is Dr. Meghna Thakur, and I am at Feel Your Best Self Naturopathic Medicine. And today we're going to talk about Botox and fillers. Yes, I have a special guest. Thank you, everyone who is joining. Saying hi to all of you. Yes. Hi, guys. Thank you so much for being here. Mr. Chahal, hash and tag social media. Thank you so much for being here. And so let me say that, you know that my philosophy is to help you feel your best self, correct? So that works in different ways for different people. So I always like to treat the root cause of the problem to help my patient feel the best self. And sometimes I have to work on their gut health to get them better. Sometimes it's balancing their hormones. So I have all these different tools in my toolkit, and I use what works for my patients. One of the successful treatments that I do offer is Botox and fillers. And I love offering this because it lets me be like a medical artist, looking at numbers all day and all of that. It's kind of fun sometimes to work on the aesthetics, and especially like when I'm doing videos, see, when I raise my, I see these lines on my forehead, right? So my Botox is almost 3 months old now. So that's why you see, these lines. And, sometimes it doesn't always go away, which is okay too. But if we can minimize something, and if that is what you want, then we have a great solution. So I am going to invite our guest today, Dr. So thank you, Karen. Thank you, Zane. 970. Hi, Dr. Patel.
Hi, Dr. Meghna. How are you?
I am doing great. Thank you so much. How are you today?
I'm wonderful. I'm so excited for our talk today.
Yes, absolutely. Thank you so much for your time. And you look beautiful, like always. So wonderful. So let me introduce Dr. Patel to all of you that are watching. And Dr. Patel is highly qualified. She's actually triple board certified. She is the owner of the Arizona Integrative Medical Spa. That's correct, right? Aims for wellness. I remember the
Right.
aims for you. Yes. And she practices pediatrics, she practices internal medicine, and she practices integrative medicine. And she has a beautiful office here in North Scottsdale. And she has been injecting Botox dermal fillers to practicing aesthetic medicine for more than 15 years now. So I'm so happy that you are here today, Dr. Patel, because a lot of times, patients have concerns about this. I see wonderful effects with these treatments in my office, but with the word Botox, patients get a little bit that, is that safe for you? So let me just ask you, what do you tell them in these cases?
That's a really great question. First of all, Botox is a medical drug, and it's derived from a bacteria called Clostridium botulinum. And most people don't realize this, but so many other medications are derived from nature. So our antibiotics are made from bacteria. Vaccines have bacterial components in it. Anti-tumor drugs have bacterial components in it. So it's not a novelty drug. It's really just another prescription medication that we've derived from bacteria. It's been around since 1978 when the FDA first approved it for ophthalmologists that were treating strabismus, which is, crossed eyes. And from there, even 10 years later, Allergan got approval for other medical benefits: spastic eyelids, migraine headaches, sweaty armpits, overactive bladder, so many other medical benefits from using this muscle relaxant. So people get afraid of the word Botox because they don't understand that it's just a muscle relaxant That is a prescription drug derived from bacteria. It is a purified protein. And just like every other medication goes through rigorous standards to make sure that it's pure and it's clean. So it's important to go to a reputable medical clinic if you're going to get medication, correct? So if you're going to get an antibiotic, you wouldn't go to the side of a street and pick up an antibiotic. You'd go to a prescription pharmacy and get your medication appropriately. In the same vein, when you decide to get this medication for cosmetic reasons or medical reasons, it's really important to go to a reputable medical clinic, make sure that they're getting it from a source that is FDA approved, that the doctor or the provider knows how to constitute the medication and administer it safely. Because like every prescription medication, there are risks and contraindications, and a proper consultation is absolutely essential, especially if it's your first time, or maybe it's not your first time, but you've never really asked those questions. I'm going to invite your audience today to make sure that the next time they go in to see a doctor for anything like this or any other prescription medication, that they ask the right questions. Am I a good candidate? What should I expect? Right? What are the risks and contraindications? So some of the risks and contraindications. If you have a neuromuscular disorder, myasthenia gravis, ALS, anything that is affecting the integrity of your muscles, you probably don't want to have Botox, right? If you're pregnant, trying to get pregnant, you're lactating, you're nursing your baby, we don't really recommend getting Botox because we don't really have any studies for safety, and it's best not to do it at that time. So there are some contraindications. Of course, there are risks. The nice thing about Botox, and you know this, Dr. Meghna, but Botox is a temporary solution to muscle movement. So it's not going to fill in lines. It's not going to fill in wrinkles. It's going to relax the muscles that cause wrinkles. And I think earlier you were expressing your forehead, and a lot of times people will come in because the lines in their forehead make them look angry, make them look tense, make them look tired, make them look unapproachable. And I always say this, people come in not because they want to look different, they want to look their best selves, right? How we look makes us, reflects on how we feel, and how we feel reflects on how we look. And we put so much judgment, guilt, and shame when it comes to this particular medication, when we don't put the same amount of social morality clauses on other medication or other treatments. So, I really kind of speak to that with my women, and I'm sure you do that too.
Yes, absolutely. And thank you for explaining it so nicely to everyone. So, what are the treatment areas that you treat with Botox in your office? Yes, you did mention about, the lines that makes one feel angry, like the glabella region, like when you frown, you get the 11 number, they say, and that can, the muscles can relax here. And that can, help. But I want to ask you, who can benefit from this? And of course, we talk to each one individually to find out. But what are the areas, what are the effects or the benefits that they can get from Botox?
So Botox, of course, as you know, is a brand. Botulinum toxin A is the medication, and we use it to treat the glabellar complex, which is the procerus and the corrugators, which makes this sort of angry look for a lot of people. We relax these muscles. It takes about 1 to 2 weeks to relax this muscle. It can last anywhere from 3 to 4 months. The way Botox works is it stops the release of a neurotransmitter called acetylcholine. So the nerve talks to the muscle by releasing a chemical substance. Botox stops the release of that chemical substance for 3 to 4 months. So the muscle does not move. Okay, so that's how it works. Now it's FDA approved since 2002 for the treatment of this complex here. 2013, they approved the treatment of crow's feet, which are the lines that form when you smile. And again, yeah, right in there. And so you can definitely treat those 2 areas. Now, everything else that we treat on the face is off label. So whether it's the forehead lines that you mentioned earlier, whether it's the corners of the mouth that sometimes we treat, or the fine lines above the lip that we treat with Botox, or the platysmal bands, which are the muscles that get tight in here, causing us to have that sort of aging neck, we can treat those areas. But again, all of these areas that we treat with Botox are off-label. And a lot of people get afraid of the word off-label, but in medicine, a lot of times medications are used for indications and off-label when appropriate and safe. And of course, if your doctor is treating something off-label, then they will hopefully mention that to you in your consultation and explain to you any risks or contraindications with that treatment. So what are some of the risks with treating in the glabellar complex or around the eyes? Well, the medication can migrate, right? So it can migrate past the orbital rim into the levator muscles. So sometimes you can get what's called ptosis, which is the eyelid might get a little heavy. If it's injected over the brow can get flattened and heavy. If it's injected too close to the eye muscles, you can have problems with vision. So again, all of these things are super important as a client to ask your doctor, how many treatments have they done? How many years have they been injecting? How much experience do they have in facial anatomy? Because it's really important to understand who you're getting your medication from and if they're qualified and trained and experienced in doing so. Even with the best training and the experience, there's always a potential for side effects. The nice thing that I always tell my patients is it's temporary. So if for whatever reason you do get an adverse effect, it's unfortunate. And again, it'll pass, meaning it'll kind of fade over the course of the 90 days. And then, of course, you can be the wiser as to whether or not you want to have it done again or make your injector aware of it and so that they take precautions so that it doesn't happen again. With my patients, I always tell my patients, after I inject your muscles, I want you to stay upright for 4 hours. No massages, no facials, and no workouts for 24 hours. I really emphasize that even if the client's been coming to me for over 15 years, because I want to make sure that the product stays in the muscles that I've injected in and doesn't get a chance to migrate into the other muscles to prevent any kind of adverse effects.
Thank you. Yes, that's a great wealth of good information. I want to say hello to everyone who's joining. Hi, Anand Sejpal for being here, Shraddha Raval for being here. Thank you all for being here, and I hope you find this information helpful. So, you know, and as you were saying, Dr. Patel, of where we inject and the effect. So I know the women, you know, sometimes like the arching of the brows and staying like a little bit higher kind of helps to achieve that nice effect. While I saw a male patient last week, and he actually likes it, you know, that his brows don't rise, and he has strong lines, you know, in the kind of middle of his forehead. So for him, I kind of go lower, but he likes that effect. So it's so important to talk to your doctor and, you know, find out how long they have been doing this, and with the anatomy of the muscles and where this injection is placed is exactly what the treatment that you're going to get. So that's very important. Besides the Botox, do you use similar products as muscle relaxants in your office?
So Botox is, of course, Allergan's signature flagship product. Came out in 2002 for cosmetic benefits. But since then, there have been other competitors on the market. There's Dysport, there's Xeomin, and the newest one is Jeuveau. I do carry Jeuveau in my clinic because a lot of times what happens is most of the time, if patients get their Botox, their muscle continues to weaken and the effects are the same or better. But in 10% of the population, they might find that they need more and more Botox or sooner and sooner treatments to get the same results. And in less than 5% of the population, they do develop antibodies to Botox, and so it no longer works well for them. So switching out the constitution of the drug by going to maybe a different isomer can help overcome that for the patient. So I do carry an alternative brand in the clinic so that I have options for people that have been on one particular brand for a period of time or find that it no longer serves them. So then I'll switch it up with someone else, with something else for a short period of time.
That's great that you have this option, and it's great for the people who are watching and feel that if Botox, you know, is not giving you the same effects, then there are other options and you should be talking to your doctor about it. Absolutely. So this was a wealth of good information about how this product works. And the other thing that we were going to even talk about today is the use of the dermal fillers. So the Botox, you know, as Dr. Patel was explaining, how it relaxes the muscle by blocking one of the chemicals that we make, while the dermal fillers, actually, the line that I use is by Juvederm, and I just, you know, got the box here, the different products that are there, and they work for the different areas in our face. And with these products, we are able to fill in the lines basically. So for example, these are my nasolabial lines. There are the marionette lines. There is, we even fill this area. So as we age, and this is a natural process of aging, like our face kind of will droop down, like the youthful look, which is more of like things that are elevated, it kind of sagging down because we lose some of the things in our skin, like, so with these products, we are actually putting back the hyaluronic acid, inside to kind of fill that. So Dr. Patel, please tell me your take on the dermal fillers.
So it's an interesting thing. So I've been injecting for over 15 years, and it's changed dramatically. When we first started injecting dermal fillers, which is a natural sugar that's found in the skin, at least the one that you've described, the hyaluronic products. There are other dermal fillers that are semi-permanent, calcium-based, silicone-based, and I don't inject those necessarily. I use only the hyaluronic acid product because it's a natural sugar that is found in the skin, and it dissolves in a matter of 1 to 2 years. So you're not left with anything permanent, residual, or chemical in the skin. Well, when we started injecting these products, over 10 years ago, we would chase lines. So we would chase the nasolabial fold. We would chase the marionette fold. Now we understand so much more about the aging process, and we understand that it's not really about the lines, it's about the structure underneath. So when we age, the natural process, as you described, is muscle and fat atrophy and ligament laxity. So as that muscle and fat starts to diminish and the ligaments start to get more lax, the skin that's basically being draped over those organs starts to fall. And if we chase over those lines with filler, we're just going to create more weight. So the proper way of treating somebody that has had changes in their facial structure is to refill the areas where the fat and the muscle or the ligaments have become lax, or even using myomodulation, which is injecting these products into the muscles to create lift. So again, it's an art form, like you described. It's really not about sort of color by numbers or following the dots. It's about looking at the anatomy, understanding where that atrophy is occurring in that particular patient, and not making them look like someone else, but making them look like their best self, right? So giving them the volume where their body needs it, not just filling in so that they start to look like pumpkins. Because unfortunately, we see a lot of that where you chase over the mid-face so much that they almost start to look simian or monkey-like because they've had so much filler in the mid-face. So I really work to do a proper consultation, taking lots of angles of pictures, looking at the person in different positions to see where that anatomy has changed, and then using the dermal filler as a tool, like a paintbrush, to really recreate and sculpt their face back to where it used to be. So whether it's creating that nice high cheekbone, that model look, or creating that chin that's going to create symmetry, or to put in lips where their volume has diminished, and really just trying to use the tool, which we call a derma filler, as an enhancer of certain places in the face. And you don't need to use a ton of product to get those results. Sometimes I could do a little bit of magic with 1 to 2 syringes of filler and really kind of change the shape of the face and recreate what used to be underneath, to create that scaffolding, to create that lift, to help support those ligaments, to help fill spaces where muscle and fat has atrophied.
Yes, that was excellent. I love how you described that, Dr. Patel. Yes, it's like a medical artist, actually understanding the anatomy of the face and filling it accordingly. Absolutely. And as you said, and my approach in practice is I tell my patients less is more. I'm more conservative with this, but I really get excellent results, and I always say we can always do less, but if you want more, you can always come back. But I don't want to leave them with too much product to begin with. So even with like 1 syringe, sometimes it's like a night and day difference for them, and it depends again on their age, on their skin type, when they started doing these things, genetics, so many things that will affect it. So yes, thank you everyone who is joining. I see people who are joining us, so thank you for being here with us. Absolutely. So, Dr. Patel, would you like to talk about like certain products that you use for certain areas, or, how um, can one benefit, you know?
So again, yes, you're right. So every filler is a different medium. It's different density. It absorbs water at a different rate. So knowing the products is really important. If I'm using a space, if I'm injecting in a space that I want to have more firm, dense material, like in the cheekbones, I'll use something as dense as Voluma. But if I want to use something that is going to give it a more plump, full look, I'll use Juvederm because it absorbs a lot more water and it can fill in a lot more in terms of the nasolabial folds or the lips. If I'm using something that I need to be very delicate with, meaning I have very tiny, fine lines above the lip that I don't want to have a ton of volume on, or tear troughs, then I use Velour, or Volbella, which are lighter, dense products, so they don't leave you with a lot of lumpiness or leave you with a lot of fill. So yes, using different densities based on where you're injecting and what the result is super important as an injector and as a patient to know that it's not always about the cheapest product that they're selling. So you may say, well, I want to have Juvederm because it's less expensive than Voluma. The problem is it doesn't have the hold and the density that you need to build out a chin or to build out cheeks. So you may actually get a less efficient result because you went with a less priced product. So just be mindful that not all products are the same, even if they are by the same company. And sometimes the product is picked by the injector for its result, not necessarily, just based on price, even though that is an important factor for a lot of people. So I'm always very conscientious when somebody does come in and they have a budget. I just like to make sure that we follow in with what they need. And I give them a plan. I tell them, here's what I think you're going to need. Right? So these are the number of syringes, and it's typically one syringe per decade. So if you're 30, you're going to be looking at 3 syringe volume loss. If you're 40, you're looking at 4 syringe volume loss. And one syringe is only a fifth of a teaspoon. So most people think they're getting a ton of product with one syringe, but it's only a fifth of a teaspoon. So there's not a lot of material there, but having that expectation, knowing ahead of time that it's going to take 3, 4 syringes to get to those results, and knowing that this doesn't have to be an overnight project. You can come in, every few months and get a syringe, just a layer on top of the old stuff. And I describe it as painting a wall. So you put on a coat, you let it dry, you put on a second coat, you let it dry, or rings on a tree, just to try to kind of give that analogy that sometimes it's really nice to have that stacking effect of product. So even if they don't have the resources to get all 3 syringes at once, they can come in periodically and get that stacking effect, which is beautiful in itself.
I love that analogy. Thank you for sharing, absolutely. And the great thing is, meeting with the patient and making this plan and, talking to them, explaining to them. I think that's very helpful. And I do the same thing. I like to meet with them, take my time to explain, what their expectations are, how I can help them, and then make a plan like that. So that's fantastic. Yes. So, Dr. Patel, for people who are interested and want to get started with this, what would you tell them where to go with this?
So, yeah, obviously, if they're in the valley, they can come see us. But if
Yes.
they're not in the valley, then they should go in and at least speak to a credentialed doctor to make sure that they're getting the right information. Even do a couple of consults in case they feel like they are not certain. Ask as many questions as possible. I'm a big fan of that. Make sure you've got all your information. We're in the era of women empowerment, right? We feel like we're women, we're really speaking up for ourselves. We're, supporting each other in our, career goals, in our health goals, in our wellness goals. But for some reason, we have found that the idea of taking care of our skin is still holds a lot of judgment, shame, and guilt. And I feel like if we are going to empower women in other aspects of their life, if we're truly going to call ourselves a progressive culture, and we're going to allow women the decision to choose, we should allow women to choose whatever it is that they want to do to make themselves feel and look good. And it shouldn't be based on our bias or our opinion of what they should be doing. So if somebody doesn't want to get injectables, That's perfectly fine. I support them. I really want them to feel good about the way they are, just the way they are. But if somebody feels like they want to go to the gym and work out, or they want to put on makeup, or they want to get their hair done, or they want to get injectables, then I support them too. So again, I empower women to pick whatever is in their vision of themselves without judgment, shame, and guilt. And if you don't want to share it with anybody that you're getting it done, that's fine too. Okay, so if you're doing it for vanity, you're doing it for beauty wellness, fine. Do it because it makes you feel good, right? What brings you joy? And that should be just about anything. It shouldn't be limited to just being authentic and natural, even though that is important. If this is in the realm of also making you feel good about yourself and look good, then it's okay too. So ask those questions. Don't be ashamed. Don't feel guilty. Talk to your friends. Lots of them have been doing it. Did you know that in 2018 alone, 7 million people got injected with Botox? That's the entire population of Arizona. And you and I are in Arizona right now. So think of that. I mean, that many people getting Botox injections. So you're not alone. And if it makes you feel good to take away some of these stress lines, it makes you feel good to look in the mirror and feel like your best self, then do it. So ask the questions, get the right information, make sure you read your consent, make sure you know your risks and contraindications, know what you should do if you didn't get the results that you wanted, and to have the opportunity to communicate with your injector. Make sure you follow up. I always schedule a 2-week follow-up with my patients, especially if they're new to the treatment. So I get a chance to, talk to them about their expectations or to help them with anything else that they might need. So make sure you've got that follow-up too. And make sure you go to a credentialed, experienced injector, especially if you're getting medical treatments such as Botox, because it is a drug and you want to make sure that you're getting it done by someone that is experienced. Derma fillers are also carry risk. You can get an adverse reaction by accidental injection into a blood vessel. You can have swelling, bruising, inflammation. So getting the right injector is super important, because if you do have complications, you want to make sure they can handle it in their clinic, so that you are safe. So that's what I would tell people.
Yes, thank you so much. Those were such important points for everyone to know, because I know sometimes these treatments even get a bad reputation, because I think a few months ago in the news there was somebody offering some Botox out of their home who was not experienced or credentialed, and there was a lot of problem, with the infection and all of that. So it's very important to get the right treatment. And also, I loved the thing about empowering ourselves and doing what makes us feel our best selves. I really believe in this, be authentically you, be unapologetically you. I really like that saying. And it's amazing that a large percentage of women who come to see me, they don't share with their partners that they are getting this treatment. So it was surprising to me before, but now it is not. But if that makes you feel better, that's okay too. It's what makes you feel better, because there should not be any kind of shame related to this, and that's the message we want to put out there too. So that's very, very important. Yes.
Yeah. And again, if you're conservative and you don't want a whole lot done, then that's perfectly okay too, right? So whatever,
Exactly.
whatever you feel that speaks to you, the decision to choose about your body, whether it's what food you put in, what treatments you get done, how you conduct yourself, that's all what we're fighting for as women. We want the right to choose. We want the right to be able to make decisions for ourselves. We want people to respect us for that and not make us feel bad about either way, whether we choose not to do anything, not color our hair, not not pretty up our face, whatever it is, it's our right to choose, right? So on the other spectrum of things, if you do decide to change things about your appearance that make you feel good, then that too should be empowered and shouldn't be judged. That's how I feel.
Absolutely. Yes, it's what you want. Absolutely. And that's great. If any of you who are here and have any questions, please put them down and we'll be happy to answer them. But I am always happy to talk to Dr. Patel. She's a wealth of information, and we've talked about so many different things. And as I say, we have all these different tools in our toolkit. And when a patient comes in, we like to provide individualized care. And sometimes we are working on the gut inflammation. Sometimes we are providing emotional support and, for their well-being. So whatever it takes for a person to feel their best self. But today I wanted to, bring on Dr. Patel and talk about this topic that sometimes has a stigma around it and get you informed about how it can help if you are one seeking for it and it has been in your mind and you haven't gone forward with it. At least you have a lot of information. And if you're in the valley, you know who you can contact. Dr. Patel's office is in North Scottsdale. Dr. Patel, do you want to put your website so people can have that in the
I
chat?
can. And
Yes,
if,
great.
and if anybody wants to learn more about injectables, I have a live that I'll be doing on Tuesday, October 27th from 5 to 7 p.m. It'll be on Zoom. And so if anybody really feels like they want to have more information, I'll be doing live injections. In my clinic, I'll be talking about different aspects of how it can help you with different areas of your face, what I do in my clinic, answer any questions that you may have about injectables in general or anything related to the skin and even health. And so from 5 to 7 p.m. on October 27th, I'll be doing a Zoom live. So I can provide that as well to your audience if anybody feels like they want to hop on and watch.
Yes, that is wonderful. That's a great resource. Absolutely. Thank you for sharing that. And thank you for your time. Thank you for spending the morning with me, educating everyone. I wish you a wonderful day.
Thank you for having me again. You do the
Yes,
same.
thank you. Thank
Bye-bye.
you. Bye-bye.